You're listening to the Jōrni Podcast. Could the hardest part of recovery be something other than quitting the addiction? Keep listening as we unravel this curious paradox. This episode contains adult subject matter, and some listeners may be triggered by this content. Listener discretion is advised. Hi, I'm Petra Brunbauer, and with decades of experience with sadness, pain, anxiety, and stress, I finally figured out how to leave all that behind. And this podcast shows you how to break free permanently so you can reclaim your sanity and find the self-esteem and energy to go after the life you desire. With real talk about mental health, holistic healing, and the tough journey of coming out the other end. This is the Jōrni Podcast. Welcome to today's episode. In this episode, we explore how the pressure to achieve and the fear of letting others down can create pitfalls that are easy to stumble into. What begins as coping can turn into a habit that feels impossible to break. Dr. Brett Cordis was the typical overachieving, people-pleasing medical student, surgical resident, and young doctor who successfully built a thriving clinical practice within the Texas Medical Center. His career, as well as his personal and professional reputation, came crashing down as his hidden secret of opiate addiction was discovered and made public. Dr. Cordis' story continues through treatment and recovery, as well as the long road toward regaining his medical license and ultimately working again. While tremendously grateful and humbled for this opportunity, he had to admit that his passion for clinical medicine had waned. Dr. Cordis has since discovered physician coaching and is inspired to help fellow doctors navigate the epidemic problem of physician burnout as well as substance abuse. Let's meet Dr. Brett Cordis. Hi, Brett. It's so great to have you on the podcast today. I've been looking forward to getting to chat with you because addiction and recovery are such important things that I wish we actually did talk more about on the podcast. And I'm very glad you're here today to share your own story and your insights on this topic. Welcome to the podcast.
Absolutely. Thank you so much for having me.
Yeah, it's my pleasure. And when I say pleasure, it's always a double-edged sword because obviously we don't enjoy these topics when we go through them, but I feel like they're so important to share. And I'm always excited to have more people on the podcast that can share their personal stories. So let's start with that and tell us a little bit about your own journey, about your own story, wherever that starts for you and however that connects up with what you do today. And maybe share a little bit about what it is that you do today with our listeners as well.
Okay. I'll share what I'm doing today first. I worked as a private practice otolaryngologist, which is an ENT doctor, for about 12 years. And now I'm a coach for physicians who are experiencing the symptoms of burnout. So I've pivoted from clinical medicine to coaching doctors and physicians and surgeons who are kind of struggling in their career with burnout and mental health challenges. My own story includes an issue with addiction and recovery. I did not start struggling with addiction until my mid-30s, but my story really starts way back when I was a child. I was raised in Louisiana in the United States, which is in the southern U.S., what I would term a pretty typical upbringing. I had both my parents in the household. I had a half sister as well. And one thing that I will mention is that academics and achievements in academics was a very high priority for me. My dad was a mathematician and taught mathematics at the local university. My mom taught English at the university. My sister was salutatorian of her high school and went on to graduate first in her law school class. And she's 10 years older than me. So by the time I was 8 years old, excellence and achievement had been modeled for me by my parents and my sister. And so I interpreted that it was a requirement to achieve and to be successful in order to receive love from them. And that was not the truth, but that was my 8-year-old interpretation of what was going on. And that's going to have a significant part to play in how my addiction arose many years later. But went to high school. I ran track and played basketball in high school. Graduated high school, went to Louisiana State University, which was in the same town that I was raised in. Both my parents taught there. And the last month of my freshman year of college, and this was when I had no idea what I wanted to do. There were no physicians in our family. There was no one even in healthcare in our family. It was all lawyers and academicians. But I had no idea what I wanted to do at all. So I picked history as a major simply because I enjoyed history. But really, I didn't know what I was going to do with my life. And in April of that first year of college, I was diagnosed with non-Hodgkin's lymphoma, which is a cancer of the lymph nodes, and subsequently went on a 16-month, year-and-a-half journey battling cancer at the age of 19, after which there were many silver linings that came out of that. But essentially, my experience as a patient, as a cancer patient, is what made me go to medical school and ultimately become a physician. It literally changed and shaped the course of my life at that time. But something of significance that occurred during that cancer battle was when I was initially exposed to opiates, which is prescription painkillers for any listeners that aren't aware. And the lymphoma wasn't painful in and of itself, but I had several surgical procedures and biopsies and things along the way. So I was prescribed pain medication at the age of 19 and 20. And at the time when I took these pain pills, they felt okay. They felt good. I remember thinking it felt like having a couple of beers, a little beer buzz, but it wasn't some great, wonderful experience. And it certainly never occurred to me at the time to take more of the pills than I was prescribed. And it never occurred to me to take the pills just to get that buzz. It just wasn't on my radar. And when I was finished with my treatment and there was no more pain, I had probably half the bottle of painkillers left over, and that's where it stayed. And any addict or alcoholic would know that an addict would never leave a pain pill bottle half filled. At the time, I did not have any experience or desire to take more than I needed. But the significant part is that's when I was initially exposed to opiates. Went on, graduated college, went to medical school in New Orleans, which is a city in Louisiana, and then graduated medical school and then went to Houston, Texas, in the Texas Medical Center for residency training. And so, as I mentioned before, I was doing ear, nose, and throat medicine and head and neck surgery. So that's 5 years worth of training at that time. So this gets us to about 2009. By now, I'm 32 years old, and I've been in school or training, some sort of school or training environment for literally my entire life. From the time I started when I was 4 in kindergarten through 32 years old, I had never really had a real job. And so I was 32 by the time I received my first real paycheck, which is really crazy if you think about it. But what that means is that I had been climbing this mountain of achievement and academic success and training for 32 years without stopping. My only kind of respite from it was when I was fighting cancer when I was 19 or 20. Not exactly a vacation. But the point is, I had been on this uphill battle, climbing this mountain for 30-something years. And I was finally at the top. I had finally made it. I was now a fully board certified doctor, and I was able to start seeing patients on my own at the age of 32. And it was fantastic. It was everything I had dreamed it would be. I loved my patients. I loved the work I was doing. I loved the clinical medicine and being in the operating room. I loved my coworkers and my partners at my practice. And this was in the Texas Medical Center, which is the largest medical center in the world. We were a very busy practice. And for the first 5 years, from 2009 through about 2014, I was living the dream. You hear people say that all the time. but it was a reality for me. I had a wife and we had two healthy young kids. Kids were in sports and going to school, and we were active in our community. We were active in our local church. My wife did a lot of volunteer work. Life was good. And so around 2014, this was about 5 or 6 years into private practice, I began to experience what I thought was just boredom. Remember, I had been climbing this mountain for so long. I'm at the top of this mountain, and instead of relaxing and slowing down and taking in the success and taking in life and living in the present, instead of doing that, my only thought was, what's next? What's the next challenge? What's the next challenge that I have to train for and then achieve and succeed in so I can get that self-love that I equated with achievement way back when I was a kid? But it wasn't exactly boredom that I was experiencing. It was really a lack of fulfillment, and it was a lack of that dopamine hit that I always received growing up after I got an A on a test or succeeded in some sort of goal in life. That had stopped when I was in private practice, and I was just living a normal life because I equated self-love with all those awards and achievements, and I began to have a lack of fulfillment. But at the time, I thought it was boredom. And from that stemmed a little bit of low-level depression and anxiety. And typically what I would do on a Friday afternoon, my wife and I would hang out by the pool, and I would have a couple of beers, and we would just relax and talk about the week and prepare for the weekend. That's what we would do on Friday afternoons after work. And on nothing special, just a random Friday afternoon, a drug representative had been to the office, and she was giving us samples of a hydrocodone-based cough medicine. And hydrocodone is the active ingredient in painkillers. And as soon as I saw these samples, I remembered my experience back when I was a 20-year-old cancer patient, and thinking, you know what? Instead of drinking a couple of beers today, I think I'll just take one of these cough medicine samples and just hang out and relax at the pool this afternoon. And that's what I did. But the issue this time, again, this is 20 years after I had done this when I was a kid. It was nothing like I remembered. Instead of just having a nice little beer buzz, it was a euphoric feeling that I had never, ever felt before in my entire life. And that low-level depression and anxiety immediately went away. That feeling of boredom and lack of fulfillment immediately went away. Opiates, for most people, make you sleepy or make you kind of sluggish or tired. But for me, it made me energetic. It improved my focus. It gave me a euphoric feeling. It seemed to be the answer to all of life's problems, honestly. From that time forward, that one cough medicine sample eventually led to a full-blown prescription painkiller addiction that would last all the way through 2019 and ultimately in my career as a clinical physician and surgeon. And that's what happened. And it took 2 years for me to advance from that cough medicine sample on that random Friday afternoon to when I was taking opiates all day, every day in order to function. I was going to work. I was performing all of the duties of a physician and a surgeon, all while being addicted to these painkillers that I was taking every day. Because if anyone knows anything about opiates, once you've developed a physical dependence on them, if you go without them, you have really unpleasant withdrawal symptoms. I was having to take them all the time. And I had always been a people pleaser during my life. I was always a rule follower. And when I told my friends ultimately and finally about what happened in the addiction, most of them responded with, wow, you're the last person on earth I would have pictured would have this problem. Again, because I was always a people-pleasing rule follower. And so I had to do a lot of mental gymnastics along the way to justify to myself why it's appropriate that I can go to work as a physician and surgeon while being obviously addicted to these painkillers. But that's what addicts do. We justify and we rationalize our drug use and whatever we have to do to maintain that habit to ourselves. And that's what I did for roughly 5 years. And my partners found out one fateful day in 2019, April of 2019, and they fired me immediately. And I finally went to a rehab facility really during the peak of COVID in 2020. And so I went on July 3rd. I was there for 90 days and graduated in September of 2020. Signed a contract with the Texas Medical Board because my license was suspended. So I signed a contract with them detailing a plan to eventually get me back to work. And that brings us to about 2022, at which time we moved back to Louisiana. We had been living in Texas. Now I'm out of work for about 3 years. We moved back to Louisiana, and I signed a 1-year contract and go back to work for 1 year from 2023 to 2024. And I had been out of work for 4 years, and recovery is very challenging. It's tough. But for me, the lack of motivation and the lack of fulfillment that I experienced being out of work for those 4 years was just as difficult, if not more difficult for me than recovery was. I thought going back to work, that was going to fix everything. Everything would be back to normal again. But what became obvious in the first several weeks of going back to work is that I liked it. I did enjoy going to work, but I didn't love it anymore. That passion that I had for clinical medicine and being a doctor and working as a doctor day in and day out, that passion had faded. And I tried to deny that reality for a while, but finally, after about 6 months in, I had to admit to myself that this is not what I want to do with my life anymore. And around the same time, I just coincidentally got back in touch with a physician who I trained with back in Houston. And she was a coach. She was a private practice ENT doctor like myself. She had quit clinical medicine and she was now coaching other surgeons on leadership skills and mental health challenges. We had been talking and she recognized some of the cognitive behavioral therapy and ideas and words I was using and asked where I was picking that up from. To me, it was just recovery language. But come to find out, the psychological aspect of recovery from drug and alcohol addiction is similar to the cognitive behavioral therapy that coaches use and whatnot. And she said, I think you'd be a good coach. And that's what happened. I decided I wanted to coach other doctors and surgeons who were experiencing symptoms of burnout, which a lot of times includes substance abuse. So I kind of pivoted. I finished my year contract out and pivoted, stopped working day in and day out as a doctor, and now I'm a coach. And so that essentially brings us to today, to current times.
Wow. Thank you
That's
for
it.
sharing that. And thank you
Absolutely.
for sharing your story. And I feel there's so many things to unpack and what you
Right.
shared with us, so many things. I want to first thank you for sharing that because I feel that's not an easy thing to share. And even though it happens to anyone of any age, any place, sex, race, no matter where, that can happen that we deal with addiction. But it is still, I feel, in society today, something that is difficult to talk about because there are certain expectations attached with it, certain stigma. People think certain things when you share stories like this openly. So I want to thank you for being brave and putting that out in the world because that is what helps others recognize what is happening in their lives and hopefully feel brave enough to speak about that with someone, even though it might be uncomfortable. It could get them some of the help that they will need at that point. With that said, I feel that there are a lot of things that happen in your life that may have gone into eventually what became this addiction to pain medication. You had a lot of challenges living in households where there are many expectations academically and with that excellence that of course adds, and later on having those same pressures in your job being a frontline healthcare provider, there are some of those same pressures as well. And dealing with a very grave illness with your cancer as well that can absolutely change your life perspective and how you show up in life. You had a lot of pieces, I feel, that came together that eventually ended in becoming addicted to painkillers. And these are the life stories. Like I said, this can happen to anyone. They have an injury, they have an illness, they are trying to cope with trauma, and that happens. I find this very interesting that also you were able to stay with the painkillers for a fairly long time. I feel that several years actually seems like it's a very long time for working in healthcare before that came to light. How did you cope with all of this mentally and emotionally when that sort of exploded and you went to rehab and then coming back and then you had to reintegrate with your family, you had to reintegrate with maybe neighbors, friends, or work colleagues that were wondering what the heck happened? How did you process all of that was happening? And are there feelings that are difficult to deal with? Is there any shame or guilt that you're experiencing that you felt was difficult to deal with?
Yes. Like I had mentioned, when I was fired from my job, I'm trying to think, by now I am 37, 38 years old, and our kids are in their early teen years. And my wife and I are heavily involved in our community. When my partners found out about my addiction and fired me, it wasn't just work colleagues that were left asking what happened to Dr. Cordes. It was like you mentioned, our friends and neighbors and community members. We didn't tell anyone what was going on. Word tends to get around. And so not only was it difficult for me to deal with this somewhat catastrophic bottoming out of my personal reputation and my professional reputation. Not only did I have to deal with that, but so did my family, which is really tragic because they had no role to play in any of this. It could be argued whether myself as an addict had a choice in all of this. Addiction is a disease, but ultimately, at the very least, those first several times that you use is a choice. But my family certainly did not have a role in that. And I felt lots of guilt and lots of shame, mostly centered around the fact that my family was suffering for actions that I did. Yeah, it was difficult. In rehab, I spent 3 months in rehab, and for me, it was a great experience. I learned just an enormous amount of information about myself, about certain character defects and the motivation behind why I do certain things. It was a wonderful experience because you have to learn about yourself. You have to learn about character defects and why you do things and why you don't do things. You have to learn about those things first in order to fix them and correct them and learn appropriate stress management tools and coping mechanisms, which ultimately for me, the addiction centered around the fact that I was emotionally immature and did not have the right tools to deal with life stress. The drugs for me was a solution for that. So I had to relearn appropriate ways to deal with life. Really, that's what I did. I didn't enjoy rehab, but it was what I needed when I needed it. Let's put it that way. And then coming back to the community, again, very, very difficult because I didn't know what people knew. I didn't know who knew what. But I will just say this. I will say that we received nothing but support and positive vibes and prayers from all of our families, friends, and neighbors. I can't recall a single person who said anything negative to me. It was almost universal support, which was surprising to me and very humbling, but difficult all the same for both myself and my family.
Yeah. Thank you for sharing that. And I am wondering, looking back now, what you know now and when the addiction first started, was there anything that would have helped you in those first few times? If anyone had said anything or if you had done something, was there anything that would have helped you speak up sooner or find different coping mechanisms? I'm wondering because some people might be out there at the very beginning of some kind of addiction because they're trying to cope with whatever's happening in their lives. And like you, they may just not have the right tools for that. Is there anything that would have helped you?
It's hard to say. And one somewhat unique as an addict in rehab and recovery, you learn that you're not special, that you're not unique the way we all think we are. But I will say one thing that was a little different about my journey is that, again, it took 2 years for me to go from using that very first cough medicine sample to using every day. So it was once a week and then twice a week and then 3 times a week and then, every other day and every day except when I was at work. And it was a very slow progression. I was able to trick myself and to rationalize myself into believing that I was not a drug addict, that I didn't have a problem. I just always assumed I could stop if I needed to stop, but I wasn't experiencing any negative consequences. It never occurred to me to stop presumptively in order to prevent a full-blown addiction because I didn't have any consequences from it. For me, that slow progression, I think, worked against me because I was able to stay in the denial phase for longer. In terms of what would have helped me, I'm not sure. I suppose if I was aware that I was going to become a full-blown drug addict early on, when I could stop on my own, I would have done that. But unfortunately, that's just not the way the disease works. Hindsight is always 20/20. I can't think of anything or anyone who could have stopped it at the time.
Yeah. Thanks for being very realistic about that because I feel like you said hindsight is 20/20, and often we look back and we say, wait, if I had just done this or if this person had just said this, then would have been different. But really, there's a lot of personal responsibility in that as well, how we choose. Speaking with other physicians or with healthcare workers or people that you coach and clients that you have, do you actually give them some of that awareness before maybe some of these addictions happen? Do you work with them on creating that awareness so that they can possibly maybe recognize some of the things that might happen before this turns into a full-blown addiction? Is that part of what you coach?
It is part of what I coach. I will say that if there is an addiction or any sort of alcoholism or substance abuse issue, my first recommendation is that they seek professional help for that. And now I can coach them and I can talk to them about my own personal journey, but I try to stay out of formally treating therapy-wise addicts and alcoholics because that's not my area of expertise. So I recommend that they get formal treatment for that. But in conjunction with formal treatment, absolutely, I talk to them about what they can expect because I just tell my story. And one thing about addicts and alcoholics is that we all have a lot more in common than you might think. That was made obvious to me in rehab. The specific rehabilitation hospital that I went to used to have been only physicians and surgeons. And a year prior to that, they had opened their doors up to everyone. And there was everyone from 18 years old to, I think the oldest person there was 76 years old, professionals, non-professionals, people with health insurance, people without health insurance. So a wide range and variety of people, but we all had this disease in common. Surprisingly, we all got along because, again, we had this disease in common, and it's so all-encompassing that we all felt that we understood each other.
Yeah. It almost sounds comforting that there's a community element to that when you're going through rehab and you have people that understand what it means to go through addiction and then come into recovery. And I feel like not everyone can maybe precisely understand that, especially if they've never experienced it themselves. So important to have that community support. And what would you say to our listeners if they are coming into recovery, for example, if they're finishing a program, they're finishing rehab, or maybe some of our guests actually have quit cold turkey and done this on their own as well. When they're coming into recovery, what are some of the important things that they should be aware of or that they should know as they're preparing to reintegrate into their, I almost want to say previous life, because it feels like so much changes when you're in rehab, reintegrate with their family like you. They might have a spouse or children. where there may be this need for answers of what happened or how are we going to continue forward, and community that you were part of, neighbors and family, friends and colleagues eventually, how should they prepare for reintegration?
Yeah, that's a tough question because there's a lot of moving parts to that and a lot of aspects of that and a lot of things. The first thing I would say is to find other people in recovery. So for me, what that looked like was Alcoholics Anonymous, where there's a meeting every day all around the world. Now, I'm not saying that should be a part of everybody's recovery journey, but it was a part of my recovery journey. And it was very helpful to be able to communicate with other addicts and alcoholics, to ask those questions to and bounce ideas off of, and sometimes just to vent with. So finding people in recovery would be one of the early steps I would advise someone. Something else is to really appreciate that addiction is a family disease. So people who have families, the families are sick too. And they are also in recovery, so to speak, because they're learning brand new ways to deal with you as the addict and alcoholic compared to when you were active in your disease. Having compassion and having empathy for your family members and family and friends, I think, is necessary as well. And it's very helpful if those people can educate themselves about addiction and recovery. A lot of times family and friends feel like it's not their problem. They're not the ones that are sick. They're not the ones with the disease. They're not the ones that made all these poor choices. So why should they be expected to educate themselves? And that's a normal response, and I understand it. But I will say it is helpful for everyone involved, for family, friends, and loved ones to educate themselves about it. Because what I found is that it's not common sense. Recovery, for me, was not common sense. I had to learn from professionals how to do it. I had to admit that I didn't know anything about it, and I had to rely on other people. And so that's an important aspect of things. If someone does recovery right, in my opinion, the ego that you used to enjoy is long gone. And you're dealing with a certain level of humility, because it's hard to admit that you have a problem that you need help with in order to solve. And addiction is the ultimate thing like that. And so once you've relied on other people to save your life in a lot of aspects, you humble yourself. That would be a third or fourth thing I would advocate for people, is to embrace that humility and give credit where credit is due to family, friends, professionals that helped, your higher power, if that's part of your recovery. That's a tough question. There's a lot of things. And as an addict in early recovery, I still consider myself in early recovery, being a few years out, but I'm in no position to give people advice. I can tell them my experience and worked for me, but I don't feel like I'm in a position to tell people what to do. That's something else I learned. But there is a lot to be learned in hearing someone else's experience, again, because the addiction, it creates a lot of commonalities among people.
Yeah, absolutely. And thank you for that. And I sometimes feel we take doctors and physicians and surgeons at the ultimate authority, especially when our health is concerned. I do appreciate very much that you're saying this is a sharing thing. I share my story. I can only share what I have been through, which I feel is very, very helpful and supportive to other people who are coming through the same journey. Looking back at your experience, you said that you're in early recovery and it's only been a few years, which I do feel a few years is quite the achievement, because I hear that it is very challenging and very hard at times. So, congratulations on that. And looking back, what has changed for you in that time since you came out of rehab and you are putting back together the pieces of your life? You pivoted from being a physician to becoming a coach. What has changed for you mentally, emotionally? Do you see life differently? Do you see yourself differently? Do you experience things differently? Has your point of validation that used to be external in order to feel loved, has that changed to becoming internal at any part? How have you come through this experience?
Yeah, that's a great question. The answer is yes, obviously. There's a lot of things different. And in my experience, I've now dealt with two possibly terminal diseases, in the cancer and now the addiction. And gosh, addiction was so much more difficult than fighting cancer for me, again, because when I had cancer, I had an enormous amount of support from the outset, which was definitely not the same with the addiction. Now, toward the end and in recovery, I had a lot of support. When people are just finding out that you're a drug addict and you are treating the community as a physician and surgeon, putting you on the prayer list at the church is not the first thing they think of. For me, addiction was more of an isolating disease and altogether much more difficult to deal with than the lymphoma. But one of the major differences mentally and emotionally for me now being in recovery is that I can slow down and I am able to enjoy achievements and successes and where I am in life. And so I'm much better at living in the present now than before. Before, I was living in anything but the present. I was lamenting any mistakes that I made in the past, and I was looking forward to challenges in the future. And I forgot to live my life in the present, which is the only time we can really affect things anyway. So it seems obvious, but it's nice to be able to live in the present and to slow down and to live life the way it should be lived, in my opinion. And when things get hard, which in early recovery, everything is hard. At least they were for me. There's first few days and weeks and months. Sometimes there are good days, sometimes there are bad days. And on the bad days, one piece of advice I will give is just to do the next right thing. And a lot of times I had to break my day up into 5-minute increments, because on bad days, I could just look 5 minutes ahead and say, what's the next right thing to do? Get out of bed, make my bed, take a shower, eat breakfast. But that can be a part of everyone's life, whether you're in recovery or not. Ultimately, everyone is going to deal with negative emotions. So just doing the next right thing is a piece of advice that I would give everyone. It's worked well for me. Again, there's lots of little pearls and pearls of wisdom in recovery, but everyone's journey is different. Everyone will have a different answer for that question.
Yeah, absolutely. But I think that's great suggestion to live in the present and take this one step at a time, one little micro moment at a time. And that helps, I think, in many situations, not just with recovery, but also with many other challenges that we face in life, coming back into the moment and just taking that breath and just doing, like you said, the next right thing. So thank you for that. That's really impactful, I feel, and very empowering also. So people don't feel like they always have to have all the answers for what's coming up, but we can really take this just one piece at a time.
Yeah, another thing I'll say, and this sounds incredibly obvious, but one thing I learned in recovery, addicts and alcoholics tend to catastrophize things, especially negative emotions. When I was active in my disease and I felt depressed or I felt anxious or frustrated or angry, my first inclination was to grab my drug of choice to numb that feeling away. And what I've learned in recovery, and again, this sounds very obvious, is that emotions are temporary. And if you just wait it out and do something to soothe yourself, whether that be pray or meditate or exercise, or what looks different for everyone, but do that, those negative emotions will go away. And so emotions are temporary. Who knew? You don't need drugs or alcohol to numb them. They're going to take care of themselves. That would be another little pearl that I wish I knew earlier. Let's put it that way.
Yeah, you're right. It sounds deceptively simple, but when you're living it, that's a whole other story. So thanks for sharing that. And I think a really good piece of wisdom for our listeners to take on board as well and work with those emotions. In the beginning, we may not really have the tools or the right coping mechanisms to work with these emotions sort of in depth. But as you said, there are things that we can do to work through them, exercise, we can do different things. And And that helps as well. So, yeah, thanks for sharing that. And I just want to touch on, and if our listeners are going through their own journeys, maybe with addiction, with recovery, maybe they have family members, how can they get in touch with you and how can they work with you? What do you offer for programs and services?
Yeah, my website is called theburnoutdoc.com. So what I do is I coach physicians and other healthcare workers who are experiencing symptoms of burnout. And so a lot of times it's very similar to having an addiction and being in recovery. And a lot of times it includes actual substance abuse or at least substance misuse. And so again, I defer the treatment for formal substance abuse to professionals, but I coach and teach healthcare providers how to deal with the mental aspect and the emotional aspect of burnout. Because again, trauma, I heard this, I can't remember where I heard this, but essentially it says something like trauma is not what happens to us, it's what happens inside of us. And so for burnout, it's how you're interpreting things. It's your perception of events. I'm able to coach people to change those perceptions such that life circumstances and the circumstances of healthcare aren't causing all these negative emotions that people are experiencing. The way to get in touch with me would just be to go to my website, which is theburnoutdoc.com. And I also have Facebook and Instagram and LinkedIn and YouTube and all that stuff. But the website is the best way to get in touch with me. And if not me, unfortunately, there are not a lot of options for healthcare workers to seek treatment for burnout or for mental health services in general, because doctors, nurses, physicians, surgeons, a lot of the times they're not the people to ask for help. I certainly wasn't, but that's the first step, and that's a courageous step to ask for help. A lot of us don't want to go to a psychotherapist or psychiatrist because of privacy issues. And coaching, for whatever reason, people have different perspective on coaching. They'll go to a coach, and a lot of times these days, it's almost the cool thing to do is to have a coach. There's a divorce coach. There's a coach for romantic relationships. There's a coach for sports psychology. It's cool to say that you have a coach for something, but it's effective. I will say that.
Yeah, absolutely. Yeah, I feel that through coaching, there's a different kind of relationship that gets built that can be very supportive and very helpful when you're trying to move forward from something. Absolutely. And we will be linking to all of Brett's offerings in the show notes as well. So be sure to check there on how you can reach out to him. And we will link the socials, we'll link his website. And Brett, I just wanted to ask you, is this something that you do in person only where you live, or can our international listeners contact you as well?
Yeah, thank you for that. No, it's all done on Zoom online. I suppose I could do it in person if you happen to live in Louisiana in the United States, but no, I can coach anyone anywhere in the world online.
Perfect. Yep. I love technology. And one of the reasons we're connected today as well. So that works out. So, yeah, anyone, if you want to reach out to Brett, please do so. We'll link you in the show notes. And yeah, it's difficult to ask for help, no doubt. And I feel a lot of the A personalities, they don't like to ask for help. I'm one of those as well. It's not something, it almost feels like a weakness that I just can't handle life when I ask for help. So I understand that there is a lot of reservations and hesitation around that, but the flip side of that is exactly what you went through. I do think that there are many upsides to asking for help and sharing, and they can be preventative, let's say, in a lot of these situations. So it was an absolute pleasure to have you here today, Brett, and thank you so much for sharing your personal story and being open and vulnerable and brave enough to, like I said, come out and share this with the world. It's much needed. And I hope a lot of our listeners take hope and courage in their own lives from what you shared today. Thank you so much for that.
Absolutely. Thank you for having me.
Yeah, my pleasure. And all the best with your recovery going forward. And I do hope a lot of our listeners connect with you and find their own path forward as well. Thank you so much, Brett. Take good care of yourself.
All righty, you too.
Thank you so much for taking time out of your day to listen in. If you enjoy the Jōrni Podcast, please support us by subscribing, sharing on social media, and leaving us a review. We appreciate you. And you can find more of The Jōrni on Facebook, Instagram, TikTok, and our website, thejorni.com. Sending you love and courage, and see you next time.